I'm Neha Garg, Research Scholar, Department of French Studies, BHU. And this paper is a joint effort with Dr. Amit Chandrana, Assistant Professor, Department of English, SRS, Sanskrit Vishwavidya Pratishthan. And our topic for presentation is a brief study on the speech assessment of the children suffering from cerebral palsy. So, first of all, we should know the basic term that what cerebral palsy is. So, cerebral palsy is a group of disorder that affect a person's ability to move and maintain and balance and posture. So, CP is the most common motor disability in children and in childhood. It means cerebral means having to do with the something is like a brain, and palsy means weakness or problems with using the muscles. So, the symptoms of this CP it can vary from person to person. It can be moderate, it can be severe. So it is also a congenital disorder of movement, muscle, and posture. And we have taken data of two most seen types of CP, which is athetioid and spastic. Athetioid is like it happens to due to damage to basal ganglia, and it is also known as the dyskinetic CP. If we talk about the spastic, it happens due to corticospinal injury. So, not wasting time and moving forward. The overview of this study is to attempt to assess the ability of the children affected with cerebral palsy, and whether they can be able to articulate accordingly in such a way that the people can understand. And it also tries to assess how well they can be able to differentiate the meaning relation. And we have taken 20 children who participated in this study and who are affected with cerebral palsy, in which two were of athetioid and others were spastic. And this also describes the major linguistic feature demonstrated by the CP affected children exposed to Hindi speaking environment. And it also reveals that the gross motor function in children with CP is importantly linked with the skill to communicate, and thus it is very much significant to take into consideration. So usually the children with disorder in the speech have difficulties using the consonant production and often cause like dysarthria. And by knowing the ratio of the children with CP affected with articulatory problems and skills to acquire the meaning values, it will be easier to give the proper treatment, which would enhance the various disorder in the children affected with the cerebral palsy. If we talk about the CP more, and CP is a chronic disorder with a sizable impact on affected children, and the prevention of CP has not been very much successful. So, however, early diagnosis and a comprehensive administration with a multidisciplinary treatment involving developmental neurologist, orthopedic surgeon, pediatrician, language and speech therapist, etc., are needed for further satisfactory control of an individual child with CP. It is more like a motor disability in children affected with CP is a major indication which may affect the intellectual of CP child speech. So it not only affects the voice production but also the articulation and their sequences of speech sounds. Hence, the motor disability in CP children will prevent them from proper oral communication. So children with CP have only limited varieties of sound as compared to the same aged non-affected children. So the phonological system also have few phonemes, or we can call it few sound units, which they may use to differentiate meanings in different pair of words. So throughout our research study, the linguistic ability, articulation, and the awareness of semantic relations and their intelligibility in children with CP have been assessed. So the major means of communication is through language, but it is dormant and inactive in children affected with CP. So this present study attempts to evaluate the intelligibility of children suffering from cerebral palsy in finding the meaning relation in which in various contexts and circumstances. Moving forward, so it is the methodology. So the research proceeded with 20 children of varied age, say 5 to 10 years, which have been observed at organization as ICD. ICD is an organization at Saket, New Delhi, where we collected this data. So they are specialized in educating and socializing CP children. So to add the additional feedback to the research, we also interviewed some parents, few parents of the children, CP affected children, and we created a list of 35 words which was prepared in which can be found on in table 1. We'll see it later. So the children were asked to speak out to prove some of the effectiveness of the factors that affect the language skill development, and others developments along with that of the linguistic development were also considered. This is the response meter to assess the study. We make this response meter where the single tick is one response at a time without without mistakes, or without any Q responses, or without uttering any kind of mistake. That is the one go response, and the plus minus sign is for Q response. Q response means like they uttered the word with help, with some little help, with some kind of clues. So there's an X response, that was a no response schedule. So they were left blank. They in which word in that word they did not responded. So that word is marked as in X. And there's a minus response which is unable to speak. We had a case which is H8 or H9, I'm confusing. So she was unable to speak, so we ran a different kind of test for her. So we gave her two kind of pictures, like one is for the data and one from the book, colored book. So she was able to like identify the picture given in the data and given in the book. So she kind of correlate that thing. So moving forward with the informant, so we are not providing names of the children who participated in this research for certain privacy reasons. So we took 20 children who participated in this study, and they were affected with cerebral palsy. I already said about this, that there are 2 children who were from ethetoid, and while the rest of them were spastic. The age group was 5 to 10 years. So H8 is a female girl, female. So she was not able to communicate. Therefore, we had to go for another test, which I already talked about. So this is the data we are going to follow. We followed on from various categories. So these are the words we have taken. So there are 35 words which were selected, and these words are selected strictly from day-to-day life, and that were frequently used by the children by age of 2 to 4 years. We teach children by the age of 2 to 4 years. These are the very common list we have taken for this study. And there was the category for fruits, flowers, home appliances, vehicle, human organs, birds, animals, and vegetables. So they saw the pictures, and then they uttered the word for this. So I'm moving forward. This is the data which I have taken for this consideration, and this is the words, 35 words. You can see there are the 10 informants in this page and 10 on this page. So these are the one go utterances. This is the one go utterances on where is single tick, and there was no utterance, no response at X, and there's a plus minus response, which is the Q response on this one. S12 you can see on the state, which is lion, elephant, and carrots, and for brinjal, train, car. So you can see this. I'm moving forward with the data. So on the basis of the available data, we find that the first section, first 10 children were expected to respond to the 35 words. You can see this one, which is the quick oral response is marked as in blue, and Q response is marked as in maroon, and no response is marked as in green, and unable to speak is violet. So you can see this pie chart. So there was 35 words, and thus the responses being 350. 10 into 35 is equal to 350 responses. So the pie chart shown above demonstrates the percentage of responses in 4 categories, which is quick oral response, Q response, no response, and unable to speak respectively. So it can be observed that the percentage of quick oral response was 57.71%. Similarly, the percentage of Q response is 15.42%, and the percentage of no response was 16.85%. And apart from this, H8 was unable to speak at all, so therefore the percentage of unable to speak is 10%. However, H1, H3, H5 were able to show quick response to the most of the words. So time response, one time response, Q response, and no response can be easily identified from the table under this discussion from this pie chart. So I'm moving to the another pie chart. This one is this without unable to speak one. So in the second section, we applied the same technique for the rest of the 10 children, and total expected response was 350. Out of 350 responses, there was 65.42% of responses was the quick oral response. 1 minute, this one. And while 15.42% were identified as the Q response here, and other responses fell in the category of the no response, which was 19.14%. So there was no case of unable to speak. So H13, H15, H16, and H19 were able to make quick oral responses to the maximum extent. So this is the findings. Moving forward with the categories of the words. So from the table, this table, one may infer the following facts like H1 and H16 were able to identify all the 35 items used in this study, and however 3 terms with the Q responses. So H1 and H16 possessed an intelligent percentage of 88.5%, and H5, H13, H20 were able to identify 27 terms, with 5 terms with no responses and 3 terms with Q responses. So these samples possessed an intelligent percentage of 77%. If we talk about the H2 and H17, here you can see H2 and H17 showed an intelligent percentage of 70%, and with 5 Q responses and 10 no responses. If we talk about the samples H3, H4, H10, H18, H19, and H15, they showed an intelligent percentage of 60% to 68%. And in samples of S6, S7, 9, 11, 12, 14, showed an intelligent percentage of 45 to 48%. So in these samples, there were more than 10 no responses. So hence these children were not so good in differentiating or assessing the relations between the words. So this was it. If I'm moving forward with the intelligence level, intellectual ability. So according to the available data, a major variation was noticed in the intellectual ability of the subjects under this discussion, and this variation can be observed by the table. You can see this table, and from the table you can infer that the intellectual ability of the children, male subject, is greater than the female subjects. If you can see this is the male subject list. Sorry, this one is also the male subject. So there were 4 female subjects. So the age factor cannot be considered for the variation in percentage at all. So the cases of spastic are quite higher than that of the ethetoid. So the percentage of intellectual ability of the subject varies from 45.7 to 88.5%, which is our 4 were the female subjects. Only one crossed the optimum level, which is considered the 50% as the threshold point if we talk. So an overall assumption can also be made that the condition of the female subject is more pathetic in comparison to the male subject. So this is the preliminary information. This is the preliminary data. So we are currently talking about. So I'm moving forward with the consonant profile as I don't have much time. So you can see the stops and nasals of the subject under this discussion can be seen in the following table. You can see that they are absent for the palatal, retroflex, aspirated sounds at all. So this is the consonant chart for the subject consonant chart, and not wasting so much time, speech assessment की बात करते हैं. So we are moving to speech assessment. Breathing, feeding, and speech are processed through the innate physiological mechanism in every one of us. So, and every child is capable of manipulating soon after the birth. So, the biological mechanism differentially to meet the needs of breathing, feeding, and speech production. So, at the same time, in children with cerebral palsy, if we talk, the defects occurred in the brain will not be enabled to affected children and to regulate the physiological mechanism. So therefore, the necessary intervention programs to enhance the speech reduction breathing, sucking, swallowing, biting and chewing, laughing, crying, and coughing, phonation, and articulation are all affected in cerebral palsy children. So the lack of these exercises and the deficient and improper nature of their indication inform that the child has some basic defects in regard to the speech production. Moving forward with the major findings. So our study of the speech of the cerebral palsy children with Hindi as their language of environment reveals that the following major findings. Children with cerebral palsy who have moderate to severe category have only a few number of sound variation as compared to non-affected child. And their phonological system also has only a few phonemes which help them to differentiate the meanings. However, these limited phonemes are also used with great inconsistencies by these children. So these defects is more marked in the consonant side songs. These children substitute one consonant for another, or in some cases they insert a consonant that is normally not required in a normal speech. So in terms of vowels, if we talk about in terms of knowledge, so the CP affected children may have more vowels than the normal users. This additional vowels may be used marginally. These may be used also in place or in addition to their equivalent in the phonological system of normal communication. So the normal corresponding pair of sound that we come across in the oral language need not to occur in the CP affected child speech. If a non-affected child has a specific phonation in his speech language, so this may not be found in the language of the CP affected child. Okay, so I'm moving forward. Articulation of the aspirated sounds such as bha, kha, gha in Hindi requires a great effort and finer perspective of the organs, which helps in the articulation of these speech sounds. And the CP child is not skilled enough to do this kind of activity. And as in the more essential and most significant to be an observer in fact of that the moderate to severely impaired CP child will neither produce all the sound usually produced in a single breath, or nor affected child can produce all the sounds normally produced following in a single mode of articulation. Like Hindi has a 5 stops: ta, ta, ch, pa, ka. A medium to severely defected child is exposed to Hindi language environment will not acquire all these stops. So that's it. These are the few resources. If you need more details about the resources, you can mail us. Thank you.
So let me start, Nega. So you have, it's really very interesting. You have taken 35 words, okay? 35 words connected to the immediate environment of the children. When you are talking about the sound system, okay, some consonants and vowels you are telling, difficulty in the pronunciation. Do you have taken into consideration that the selected words are phonetically balanced? Okay, so that's one question. Second question, by identifying such, through your findings, do you want to suggest any kind of remedial measures, for improving the recognition? You got my points?
Yes, sir.
Yeah. Yeah.
Yes, sir. I would like to answer the second question first. So definitely we are going to suggest for the remedials. As we know that this is like non-curable disease, non-curable kind of, you can say, mental disease. So this is like we went for this study for remedial purpose only, because the parent still don't think that the child with CP have a speech problem, so they do not go for the speech therapy, do not go for any kind of a speech assessment. So we want people to be aware, to understand the problems, and definitely they go for the physiotherapy, then why not for the speech therapy as well? So we want to be parents to be aware that they need to focus on both perspective. So this is for this reason. So that's all. Amit, okay. Would you like to answer the first question?
Carry on.
What was the
first
question?
Next time, maybe this pilot kind of study, just see, another, the follow-up question is, you said, because by identifying the maybe in the phonetic system or in the speech process, the therapy,
Yes, sir.
so that the assumption is the CP affects the physiological system. Then through identifying that, you are going to give some kind of remedial measure. Do you have any evidence that CP children are affected, maybe mostly affected in the tip of the tongue, or maybe in their lips? That kind of studies are available, or just this is the pilot kind of study?
This is a pilot kind of study, sir, because we are thinking for further more evidences and for the more research perspective for this.
All right, Neha.
Yes,
Good,
sir.
all the
This is,
best.
sir.
It's a wonderful study.
I would like to I would like to thank Bridges sir first of all, because he was the first person who draw my attention towards this topic. So thank you, Bridges sir, and I'm open to comments, sir. Please.
I was curious about this. It's good that you have done this, but I'm just curious whether how did you select the words?
Sir,
What was
this is the
the
most
method which you used for that?
So this is the most common word list, like children with normal, non-affected children used to study from the age of 2 to 4 years in their house, in their home. So this is the most common words. That's why I picked up these terms. As a parent, I know that these are the basic terms. So I kept these words for this data collection.
Okay, but what I suggest is it is better if you have some standardized book or something like that. From that you can take that. Okay, take the words randomly and get it
Yes.
selected by some of the, you can say, experts, so that it is familiar with the, like, everything, like conducive with the language or not. That and all you should take firstly, and then once you select that, then you go for the data collection. That's what is my suggestion for that. But okay, whatever you have done is good enough, because common words you have taken. Second thing I would like to add here is, like, you can check one book, I think Shamla Madam's book, K.C. Shamla.
Yes, sir.
Dr.
Yes,
K.C.
sir.
Shamla, she has worked on the cerebral palsy. So she has published a book with CIIL Mysore only. So it is available in CIIL Mysore, that's what I feel. So because I have seen that book there when I went there. So you can just check that book. You will get lots of inputs from it. So it
Sir,
is
I
basically on
have
cerebral
that
palsy
book.
only.
I have
You
that book
have
you
that.
suggested
Yeah,
on the
good.
first time, so I
Yeah.
bought it from there, from CIL. I was there
Okay.
at that time, so I bought it from there. Thank you so much, sir. I will definitely add these points and definitely go for the book, any resources for this data collection, for further data collection.
Yeah, it's good.
Okay,
Thank
Neha.
you so much. Thank you, sir.
Thank you, sir. Thank you, Amanti,
Okay.
sir. Thank you, sir. Thank you, Brijesh, sir.
Okay,
Thank you,
thank
everyone.
you, Rajesh, and also I thank Neha for her wonderful presentation.